Good morning. My name is John Michael Bryant. I'm a fourth-year radiation oncology resident at Moffitt Cancer Center, and I'm here at ASCO 2024 in Chicago to present our research on the magnetoelectric nanoparticle and the first evidence of its irreversible electroporation effects and diagnostic capabilities in vivo. So what we performed were two in vivo studies that consisted of a total approximately 60 mice. Essentially what we did is we were able to inject these particles through the tail vein, and then we were able to use an active targeting mechanism that's able to exploit an inherent property of the cancer cell membrane due to its relative non-polarity compared to normal tissue to have the particles preferentially attract to those cell walls and to aggregate. After we did that targeting process, we then performed MRI relaxometry in a 7 Tesla small animal imager. And what we found was that for mice that had at least 300 or 600 micrograms of the magnetoelectric nanoparticle, that none of these mice demonstrated any tumor growth at 1 week after, suggesting a pretty significant ablative effect as compared to controls. You can see here as an example of the baseline flank tumor. This is the tumor after 7 days. You can see it in the process of completely resolving at day 14 when it's been completely resolved, and then the stable response at day 97. Importantly, one of the other findings that we've with these particles is that the degree of modulation in T2 at time of treatment correlated with the degree of volume response at 1 week. We performed a couple of in vitro experiments as well in order to determine that the mechanism of action is irreversible electroporation. And then we did not find any toxicities within these mice that got the active NPs versus those that did not.